This morning, we're going to consider the devastation that follows the diagnosis of cancer in a child. And with us today are some people who have dealt with it. Dr. Sam Gross is here. He's been with us before. He's Director of Pediatric Oncology at Rainbow Babies and Children's Hospital here in Cleveland at Case Western Reserve University. And he is a professor of pediatrics at Case Reserve and has spent his professional life dealing with the problems of children with cancer. And as we'll hear from him this morning, there are hopeful new strategies and techniques being utilized to help children. Also with us today are Michael and Sue Clegg, who are the parents of a 5-year-old child who some time back was diagnosed as having cancer. Thank you both, all three, for being with us this morning. Doctor, how many children get cancer?
Well, of all the cancers that are diagnosed annually, if one considers the pediatric age group up to, say, 21, only about 3% of them are going to have cancer. But in terms of more realistic statistics, in Cuyahoga County, approximately 8 out of all of the pediatric age group will be diagnosed as having, 8 out of every roughly 100,000 will be diagnosed as having cancer every year. And if you just multiply that by the number of residents in Cuyahoga County, you can get a rough estimate of the number of new cases that will be diagnosed annually, which is quite a bit.
Quite a substantial number. What different types of cancers have been diagnosed in children? All different kinds?
They run the gamut from brain cancer all the way through leukemia. Some of the cancers that one identifies in adults you don't see in children. Conversely, some of the cancers you see in adults, like lung cancer or bowel cancer, you don't see in children. But most of the cancers in children are leukemias, kidney cancers, brain cancers, that sort of thing.
How old was your son, Scott, when he was diagnosed as having cancer, Sue?
He was 3 years old. It was 77, June of 77.
What kind of symptoms had he been manifesting that made you uneasy about his condition?
Well, at the time, our 2 other children, our older children, were at home with the chicken pox. And he had a low-grade fever, which made us believe that he was coming down with the chicken pox. And he had, later on, spots. He broke out in broken blood vessels, which is what it turned out to be. And I called the pediatrician, and we went in for a checkup, and he, right away, decided that a blood test should be taken, and from there the bone marrow was taken, and as soon as they took a look at him, the medical profession, they got the ball rolling.
Yes.
But we thought he was coming down with chicken pox.
But from the time you got him in to see the doctor, it was a fairly quick period of time until you knew
Yes.
the truth. What was the diagnosis? What type of a cancer was it?
Acute leukemia.
Acute leukemia. What kind of a strategy was confected by the physicians for immediate treatment?
Well, he was put on a protocol and put in the hospital until he went into remission. And from there, we had a series of other problems because the blood count is so low. Different infections were a problem, and he did get the chicken pox then. And it was, there were quite a few things that we had to deal with other than just the leukemia. He went into remission quite quickly, as a matter of fact. So it was the other infections that we were dealing with after that, and
Right.
trying to fight those things.
Yes. Michael, did you speak with him about it? Of course, at the age of 3, he's a little young, I suppose, to understand what's going on.
Well, we have a little bit of a problem because Scotty has Down syndrome, which he was born mongoloid. So the leukemia rate in those kind of children is a little bit higher than the non-retarded child. So he doesn't have some of the anxieties and concerns that older children would have. But since he was so young, most young children, whether they're retarded or not, you don't get into a life-death discussion with them, of course, because of their age.
How about the older children? What were their questions of you about him?
Well, I think their biggest concern was every time they felt ill or got a bruise, their concern was, do I have leukemia? And there was this fixation with perhaps they got it too, and we had to give them the assurances that we thought we were experts in the hard way on knowing what it looked like, and we assured them that they didn't have it. And there are some medical statistics, I understand, that support the fact that rarely does more than one sibling in a family get leukemia.
And they grasped that. You were able to
Yeah, I think they did.
allay some of their
And
fears
then,
by talking about it, by confronting it directly.
we try to have as open communication as possible.
We're going to pause here just for a moment or two, and when we return, I'd like to ask you about the importance of being able to communicate with other people about this matter, and how important it is to be as open as possible. We'll pause for just these few minutes, and then we'll be right back. Here's Joel now with the news. I should say good morning to Christopher and Tracy, shouldn't I, out there this morning? They watched their mom and dad on TV this morning. Good morning out there. With us today are Michael and Sue Clegg, whose son Scott is 5.5 years old and who was diagnosed a couple of years ago as having leukemia, which is now in remission, and Dr. Sam Gross, who's professor of pediatrics at Case Reserve and director of pediatric oncology. And an extraordinary thing has happened in the past decade in the treatment of the leukemias. It just seems like they're put into remission, and the remissions just go on and on.
Well, not everyone, but as you say, in the last decade, changes have occurred that are really very exciting and something we really did not anticipate. And I suspect that it's because of the very effective use of chemotherapy. It's true that you can anticipate, it's true that you can use the word cure in less than an ephemeral sense today. I mean, it really does have significance. There are patients who are being cured of leukemia, which is something we never anticipated as little as 10 years ago.
What kind of advice do you give to parents who have a child who is, let's say, 10 years old and diagnosed with a cancer of some kind? How do you, when they say, "Doctor, what can I tell my child?" What do you say?
Everything.
Tell them everything.
I think what you do actually is after the initial interview with the parents and you get some idea of the family constellation and the support system there and how the family wants to interact in this approach with the child, then you sit down with the child and with the family or with the child alone, and you discuss it openly, as clearly and as concisely as you possibly can. And you'd be surprised at some of the answers you get. For example, when I told one chap about 10 years of age that he had leukemia, I didn't say it quite as bluntly as that, but when I went through the process of explaining, and I said, "Now, did I make myself clear? Do you have any questions?" He said, "Yes. Can I get a motorcycle?" And, you know, all sorts of different responses occur. He wanted the motorcycle because he wanted the motorcycle, period. He'd always wanted a motorcycle. And he thought this was a good chance because I'd asked him a question.
Yes. Well, do they, the little kids, when you're talking to them, do they have a grasp of the significance of what's happening to them?
Not the very small children, no. It's very difficult to explain to a child who is preschool or early school years what leukemia really means. You try to explain to them, you try to tell them that this is some disorder of the blood which requires constant therapy and that they will improve and they'll get better and they'll go to school and they'll play with their friends and everything will be just fine. But it's not easy to tell it to a very small child.
Sue, is it important to you to have other people that you could talk to? Did you feel that you needed to talk to somebody who had been through what you and Michael were going through with Scotty's illness?
Well, we have a very strong family relationship, so that we did depend on each other a great deal. In our particular situation, we did, however, see many families that did not have the strength within their own families to cope. We saw many husbands or wives that couldn't handle the whole situation, so they would just have to leave. They would have to get out. And I think in that case, it would be terribly important. Our friends were very supportive and wonderful, and we could turn to them, but they didn't have a child with cancer, and so we couldn't really depend on them for support in that direction, and it did help to talk to people that had a similar problem.
There is an event coming up which will, in part, undergird the establishment of a new facility up in the University Circle area for the families of children who have cancers of various kinds who are in treatment at the university hospitals. What is the purpose of a facility like that? Is it just so the families can be close at hand?
Yeah, we're very excited.
It's called Ronald House or Ronald McDonald House.
Yeah, Ronald McDonald or the Ronald House. Yeah, we're very excited about that because it gives the parents and the siblings of patients who come for therapy or who have to stay in the hospital for lengthy periods of time a place to stay and a place to talk and a place to meet, and at virtually no cost. We're very thankful, of course, to the McDonald Corporation for helping set this up. But it is especially important because patients come from quite far distances quite frequently. And having a place for them to stay, they don't have to worry about how long they can stay and what it's going to cost them.
Or $70 a day or whatever. You know.
Well, yeah. And just to meet with the other families and talk with them and talk with our nurses and the social worker and just get together for groups and do whatever makes them more comfortable is really a very exciting thing for this city.
Well, the Cleggs live here, but there are people, as you say, who have to come here because of the state-of-the-art medicine that is being practiced in your departments at Babies and Children. So if they're there, they have to have a support network, and the support network sometimes it just happens around them, doesn't it, in a setting like that?
It's really spectacular.
Yes. We should also say that from the 5th through the 17th of March, at the McDonald's restaurants, 30 cents of every Shamrock Shake that is sold. It's green, but you can still drink it. It's still good. And 30 cents of every one of those that's sold for that long period of time by every McDonald in northeastern Ohio will be going to the Ronald McDonald House, which means probably that some $60,000 will come in if past projections are correct. $60,000 for the support of this house, which will, of course, be matched by other monies as well. So it's something that you can feel good about when you're going into your neighborhood McDonald for a Shamrock Shake. I want to give our phone number here. Our number is 578-1000. Michael and Sue Clegg are with us this morning, and we're talking about cancer in children, and Dr. Sam Gross, who is professor of pediatrics at Case Western Reserve University. We'll be right back and take calls. When you learn that your child has cancer, you're going to be devastated. There's just no way around that. And I'm wondering, ought you to not let your child see you break down? That is to say, ought you to not cry in his presence, Doctor? What do you think? You're going to have to cry.
That's a very difficult question, really. I usually encourage the parents to put up as much of a front initially as they possibly can to take away any anxiety the child may have. And this is, I think, important. I suppose crying in front of the child is not so bad, but I've always felt contrary. I felt that try to put up a false front.
And one of the points we were talking about during the break is that a place like the Ronald House, which is now being put together by you and others and lots of volunteers and hard workers, means that you can go there, and if you're gonna be crushed by this thing, that's where you can go to do it. Have those moments of privacy, those moments of grief, and maybe those moments of fellowship with others who have been through it.
And there'll be some joy in the house, too.
Yes. Let's take a few phone calls, see what kinds of questions we have out there. Good morning. Go ahead.
Good morning, Fred. I have a question for the doctor.
All right.
I wonder what his opinion is on the Laetrile question.
Okay.
There's nothing that I know of that supports the use of Laetrile in the treatment of childhood cancer.
Your question, please.
Good morning. We, too, have a praiseworthy child with Down syndrome, and I wonder, or I understand at least, that these children are highly prone to getting leukemia. Is this so, and would the doctor please elaborate? Thank you.
Okay, thank you.
Well, I can't tell you why it is so, but it is. The risk of a child with Down syndrome getting leukemia is about 20 times that of the other non-Down syndrome population. However, it drops off very sharply after the age of 7 to 10, and it roughly parallels the rest of the population after that period of time. What the precise relationship is between leukemia and Down syndrome is moot at the present time. It may be related to the chromosomal defect, but nobody knows.
Good morning. Your question, please.
Yes, I have a friend whose son who was just recently diagnosed as having leukemia, and I was wondering what I can or can't do as a friend to help her and her family.
Sue?
Just be her friend. I really can't think of anything more explicit than that.
Be available.
It is
They're in the
difficult
hospital.
sometimes to face talking with somebody that's going through a difficult time like this, and we did have people that found it very difficult.
They don't know what to say sometimes.
They don't
do
know what to say, but I think if you just be there and be a friend, that's the best thing. That's the thing that we found the most helpful.
And just to add to that, when we had to take Scotty back in several times to the hospital, and the other kids needed some help, we had friends that brought over some meals and salads and made sure that our other home kept together, and that was a tremendously valuable thing.
Good morning. What's your question, please?
Good morning, everyone. I'd like to ask Dr. Gross. My daughter has recently been a patient of Rainbow Babies and Children, and she was born with several birth defects, and I was wondering, what is the correlation between a baby born with some severe birth defects and later maybe contracting cancer?
Okay.
Well, the so-called classical one, of course, is Down syndrome. The other birth defects so vary that it's impossible, in general terms, to predict whether a child with a birth defect will have leukemia. Certain birth defects have an association.
But let's say if it was spina bifida, for example,
No.
there have been no studies to indicate
There's
that
nothing
any-
to suggest.
Yes.
No.
Your question, please. Good morning.
Yes, I would just like to say that my son has been a patient of Rainbow since 1973, off and on, and he was diagnosed as terminal, and he has had 3 successful remissions since that time. And Dr. Gross's staff specifically is responsible for it. And I would just like to take this time to say thank you. And this is Mrs. Azzarello.
It's a great commercial.
All right.
Hi,
Bye-bye.
thank you very much. Good morning. Go right ahead, please.
Yes, could you give me the symptoms of leukemia, and is leukemia ever act like another blood disorder? I'll hang up. Thank you.
Thank you.
The symptoms of leukemia are so varied that it would take me an hour to go through all of them. And for the sake of those who may feel they have leukemia once I go through it, the answer is if you have any problems, go see your doctor.
And he'll know or
Yeah.
she'll know what to do next. Your question, please. Good morning.
Yes, I would like to say that my daughter was hospitalized 2.5 years ago with leukemia, and I just wanted to make a comment on what wonderful people there are at the staff of Rainbow Babies and Children's Hospital, and we thank God for Dr. Gross.
Well, gosh, getting lots of good testimonials this morning. What is your comment or question, please?
Well, I'm quite interested in the project, A Home Away from Home for leukemia children and parents. Sounds quite exciting. I'd like to know 2 questions. One, what is the total project cost of this Ronald House? And secondly, how can I make a contribution?
Okay.
Well, thank you
Put
for
your
the
mic on
question.
those.
Absolutely delighted. We have to raise $508,000, and we have been the recipients of a loan for that amount, and now we got to pay it back, and we're going to be working very hard to do that. We have set up a post office box number, which is 95,000, and the zip code is 44101. And if anybody is interested in making or helping us, sending something to the Ronald House at Post Office Box 95,000, and that's 44101, would be just gratefully received. And we're going to have also a volunteers meeting on March 6th at 8 o'clock at the hospital for anybody who is interested in working on the house.
And anyone who's interested in finding out more about that could probably
Call into the volunteers
call into
office
the
at Rainbow
volunteers
Babies and
office at
Children.
Rainbow.
That's right.
Okay. And your question, good morning.
Thank you, Fred. My question's for Dr. Gross.
Okay.
Please. Dr. Gross, we have a 17-month-old little boy, and we've had him now for four weeks. He left for Chicago yesterday. The mother called and says that he has just since yesterday, he's got his diarrhea back again, which we thought we had cured. And she thinks the culprit was bacon. Now, I was wondering, I'm an old-fashioned grandmother, and I was wondering, why wouldn't a dose of castor oil be good for a baby that has this diarrhea?
Well, gosh, that's really beyond our purview this morning, isn't it?
Yes,
yeah,
sir.
That sounds like something for your own local physician. Probably, if you were to call your own personal family physician, I'm sure he could set you on the right track for that. Well, let me say once more that from the 5th through the 17th of March, if you drink a green milkshake from McDonald's, you'll be making a contribution of 30 cents, really, to the Ronald House, which is now being put together up in University Circle for the parents of children who are cancer patients at Rainbow Babies and Children's Hospital. And there you see on the screen the address if you'd like to make an inquiry or make a contribution to this worthwhile cause. Ronald House, Box 95,000, Cleveland 44101. Michael and Sue, thank you very much for coming down.
Thank you.
And Doctor, it's nice to see you again.
Thanks.
Thank you very much. We'll be right back.